All right, we come to this now. Most medical aid schemes have begun preparations for phase 2 of the COVID-19 rollout, and there's been some uncertainty as to how the vaccination program will actually work. So this is in relation to people who are covered by a medical aid scheme and those who are not. To get some clarity on these processes and how members and dependents will be impacted, Dr. Stanley Moloabi from the Government Employees Medical Scheme speaks to us now from Johannesburg. Doc, good to have you, and thank you so much for joining us this Monday morning. And I suppose this is why you're here, for some clarity. How will this vaccination rollout then work for those who are covered by medical aid schemes and those who aren't?
Good morning, Tumelo, and good morning to the viewers of eNCA. The basic way it's going to work in terms of medical aids is that medical aids are required to pay for the cost of the vaccination because it is a prescribed minimum benefit in terms of the law. So what happens is when your time comes, and I'm saying when your time comes, is on the basis that you will have registered on the government's EVDS system, the electronic vaccine data system, which has been announced by government. When you get an SMS that you are supposed to go and vaccinate, when you are in a medical aid, you then go and vaccinate, and then your medical aid will cover that cost.
Doc, I understand there also, some uncertainty around, addresses when it comes to either, depleted savings or even around co-payments. What needs to be done there, or what do South Africans need to do to ensure that they clarify that information?
I think what the South Africans who are on medical aid should know is that when a condition, and in this case we are talking about COVID-19, when a condition has been declared a prescribed minimum benefit, there are no co-pays that are applicable. So what happens is that when you receive a service, and in this case we're talking about the vaccination, the doctor or whoever the healthcare provider who will be giving the vaccination will submit a claim to the medical scheme, and the medical scheme will then pay in full. So there should be no co-pays. All
right. And also in terms of, I understand some that have been trying to register on the online system that don't qualify yet. It seems that has also been quite, a challenge and a reality there. Just please give us some insights on that issue, registering when it's not yet your time.
Yeah, so I think we should follow the announcements that are coming through from government. As we know that the vaccination program is government-led, the National Department of Health is the lead department. They give announcements on who should register. So I think two Thursdays ago, the minister announced that those who are over 60 are the ones who qualify. Whether you're on a medical aid or not on a medical aid and you are over 60, are the ones who are supposed to register on the EVDS. So if you are below 60, you should wait until the announcement comes through. That is the only way we can make that, the registration process is in an organized manner. When you haven't been called to register, please wait your turn.
Yeah, and I think that, clarity is quite important so that, the smooth running of the program is also supported here by South Africans. But also, Doc, on the other hand, I understand that there might have been some perceptions by medical aid scheme members around the vaccination program, whether it was around the halting of the Johnson & Johnson vaccine, which we understand the minister will be announcing, or rather has made that statement public, that they have resumed, or they will be resuming with the J&J vaccination rollout program. We'll be talking to him at 7 o'clock for more details. But are there any myths that you would like to demystify, especially around medical aid scheme members in terms of their perception around this vaccination program, which may not necessarily be true?
Yeah, so we did a survey at the government employee medical schemes, and the regulator of medical schemes, the Council for Medical Scheme, also did a similar survey. And what we find out of the survey, just in brief, is that there's what we call hesitancy. Hesitancy to vaccinate is based on these perceptions that are, all over in the media. So what I would advise is that people should try and get information from credible sources. And, like your eNCA, it shouldn't be just anything that is out there in the media. Government has tried its best to ensure that information about safety, it's out there. And when there was a need to act, like in the Johnson & Johnson case, when there was information that came through from the studies, the government then halted the study. But as you have just mentioned, the government will be giving information on the way forward. So we must base our actions relating to vaccination on credible information. That's the important message that I would love to bring forward.
All right, Dr. Stanley Moloabi, it's a pleasure talking to you, and thank you so much for your time this morning. Doc, and as he's mentioned, eNCA being your credible source of information, we'll be having that conversation with the Health Minister, Dr. Willem Kize, come 7 a.m. this morning.